Things you need to know about ADHD stimulant medication. I'm Dr. Simon Hill. I'm a consultant psychiatrist. As you can see from the grey hair, I've been doing it a while. So the first thing I tell people about stimulant medication, these medications are related to amphetamine. Sounds a bit scary, but it was found that these medications have a real impact on ADHD symptoms. So all the stimulant medications are actually related to amphetamine. Next thing to say is that if you're prescribed one of these stimulant medications related to amphetamine, there are going to be two major chemicals. It's likely to be either methylphenidate or lisdexamphetamine. There are others available, like Adderall's actually a different one, but lisdexamphetamine and methylphenidate cover a lot of the market with brand names like Vyvanse, Elvanse, Concerta. These medications only work on the days that you take them. There's no build up to the next day. And that actually means you don't have to take them every day if you don't want to. Some people take them on days when they've got lots of boring tasks that they need to be able to concentrate on. Others take them every day of the week because it helps them with their organisation, planning, all that sort of stuff. So it's generally a choice how many days a week you take it. A lot of people take it every day. Lots of people don't take it on weekends. Lots of people don't take it on holidays. Next point, these medications, all of them, tend to reduce appetite for food. So you probably should have breakfast before you take them. The appetite will be reduced during the time when the medication is active. So for a long-lasting medication like lisdexamphetamine, that could be 10 to 14 hours. But if you're on Adderall, it might be just 4 hours. If you're on short-acting Ritalin, it might be just 3 or 4 hours. During that time, your appetite will be reduced. Some people lose weight on these medications, so it's important to monitor your weight. And I wouldn't prescribe it to anyone with very low weight or a history or anorexia nervosa, for example. Another common issue with these medications is that they tend to increase blood pressure and heart rate, usually only marginally, but it can be a problem. And we don't want to cause anyone hypertension, that's raised blood pressure, because that can cause things like stroke, cardiovascular disease. So before starting these medications, you need to have your blood pressure okay. There have been occasional sudden deaths, usually when patients got an undiagnosed heart condition or they're using it with illicit substances. So if you've got a heart condition, an arrhythmia or something like that, a psychiatrist, a sensible psychiatrist, would need to have a discussion with a cardiologist. They would need to know it was safe to go ahead before prescribing these stimulant medications. Blood pressure will need monitoring if you're on stimulant medication, definitely. Most people can do this at home with a blood pressure monitor. Other common side effect issue is that as they wear off at the end of the day. So let's say you take lisdexamphetamine or Concerta in the morning and it's wearing off by late afternoon. Some people get a real crash in their energy levels at an inconvenient time. It's not very pleasant. Sometimes that goes away with increasing the dose of the medication. Sometimes it just goes away with taking it day after day and people get used to it. Another common issue with these stimulant medications is in the first few days of taking it, they can make people feel a bit emotional, a bit moody, anxious, low in mood, sometimes irritable. Usually that goes away, but if it doesn't, then you probably want to try a different medication. The other thing to note about these medications, you've got to be patient about dose. The initial dose you started on might not be the right one. It might need to go up to get the full impact, and that's often the case. Other issues worth noting are they're very occasionally addictive, and if you've got a history of addiction, you probably shouldn't be started on a stimulant medication. They're related to amphetamine. But in general, most people tolerate them well. But what I do find is that the response is very variable. Some people get a magnificent response. They describe it as life transforming, and you'll have met people who describe their medication as being life transforming. Their life has changed, and certainly that's true for some people. It really does have a massive impact on their life. But there's another group who it doesn't really help that much, whichever stimulant medication you try. So it's not a magic cure, but in some cases it can have a remarkable effect on ADHD medication. Thanks, bye.